Okay, so I'm Dr. Pierre Fenaux from Hôpital Saint-Louis in Paris. I'm also chairman of the French Myelodysplastic Syndrome Group, MDS, and I'm co-leader of the MDS part, which is in work package 2, where the idea is, of course, to try to by using great patient numbers and great number of samples, trying to define better a few questions. And the first question we're going to tackle is the prognostic factors of treatment with hypomethylating agents, which are currently I would say the mainstay of treatment in high-risk MDS. So we plan to collect about greater than 3,000 samples, and probably now closer to 4,000, and trying to refine the prognostic factors of the patients overall, but also of some subgroups, like, for instance, chronic myelomonocytic leukemia, trying to define the prognosis of some cytogenetic groups, molecular groups, to analyze also the long survivors, those who have prolonged response, the initial complications like infection. So I think this big number of patients will allow us to respond to quite a few questions. Many European groups are included, and they have sequenced many of those patients. So we plan probably to have about 1,500 patients with complete sequence. I mean, on most involved myeloid genes, and also other tests should be available in small numbers of patients. That's a few hundreds, like flow cytometry, like RNA-seq, and other data that will help us more precisely define the outcome of those patients, which is currently not very well known. Yes, it's true. I mean, we've had the opportunity to work on 200, 300, perhaps 400 patients, but never as many, and I think this will help us to answer many questions. I forgot to say, for instance, the optimal number of cycles before transplant, when a patient can be transplanted, what drugs we should combine to hypomethylating agents, because a few hundreds of patients have been treated with drugs in addition to hypomethylating agents. So it's really, well, I think the first opportunity we've had to work with such large cohorts of patients, and I hope, and that's the first project, but of course there could be many more projects in the field of MDS. It will be to define the outcome of specific subgroups, as was done or is being done in acute myeloid leukemia. So this allows you to determine what, I mean, the outcome, the potential, the outcome of specific groups, and therefore better tailor therapy and have more individualized therapy for each patient.